All right. Okay, welcome everybody to our session today. We're going to go over a short presentation, tell you a little bit about the MANNA Institute, and tell you a little bit about the RFP, or I should say reinforce a few things about the RFP, and then most of the session will be spent on your questions. Okay, a little about the MANNA Institute. The staff of the MANNA Institute is myself. I'm Dr. Julianne Henstenberg. I'm Director of Research and Evaluation at MANNA. And Adrian Glass, who you probably corresponded with to sign up for the seminar, is our Program Administrator. The goal of the MANNA Institute is to conduct research and evaluation activities around the role of nutrition on health for people with serious illness. We are a subdivision of MANNA. Many of you probably know MANNA. We have been in existence in the Philadelphia area for 30 years. We provide medically tailored meals to people with serious illness who also have nutritional risk factors for a variety of reasons. We are separate from our programming division, and our role is to lead research and evaluation initiatives. We do educate healthcare practitioners and consumers, and we share our findings and best practices for the goal of looking at what are the best models for medically tailored meal provision and nutrition counseling services with those meals. This can be seen on our website. It's a model, it shows the model of what we're trying to do. So this particular RFP is on the left-hand side of the picture in our research and evaluation initiatives. We're looking to develop evidence-based research to build high-quality programming. We also do, though, education. We work with students in internships and fellowships. We do have a health professional lecture series that we've developed, and our second one will be coming up in March. Ultimately, we will be able to do patient and client education out of what we find as our best practices. And in addition, we do present our findings at conferences and lectures. So we do focus on information sharing so that we can all develop best practices in these areas. Okay, so on to the request for proposals. So we're looking to measure the impact of MANNA's medically tailored meal program in patients who experience cancer, but particularly have a non-terminal cancer diagnosis. We will be awarding up to 3 pilot grants of $50,000 each. Our purpose is to measure the impact of our medically tailored meal program and nutrition counseling services on this defined population of patients who have a non-terminal cancer diagnosis. And our goal is to identify appropriate outcomes and potential evaluation tools for ultimately incorporating in a clinical trial protocol. So after this round of grants, when the results are complete, we will be developing a second RFP and offering that for a clinical trial. So again, we would like to know the effect of MANNA's program of medically tailored meals and nutrition counseling on health outcomes and healthcare utilization or costs in patients who experience a non-terminal form of cancer. We're particularly, the right is a list of potential outcomes. These are some of the suggestions that we thought of, but we do rely on you to tell us what you think are the best outcomes. We were considering things like treatment adherence, food and nutrient intake, nutritional status, including clinical biomarkers, physical health and/or function, emotional health, quality of life, and healthcare costs. We do have research in the area of medically tailored meals on healthcare costs and utilization at a national level. So we would love to have those types of factors included in the research, but the research should not focus on those factors. We are more interested in this pilot in really looking at factors more in the health and behavioral realm. So again, the patient population should have non-terminal cancer diagnosis. It's not restricted to any type of cancer, and they must have a good chance of extended survivorship. Any methodology that you propose would be considered, and it can be experimental or observational in nature. What we'll look for is to have quarterly reports. These will not be extensive. Basically, we want to hear about the progress of the report, of the research, perhaps in also short monthly phone calls. We will ask for a final written report at the end of the funding period, and any appropriate recognition of the MANNA Institute if any of the research is published. Eligibility criteria. So applicants for this RFP should be healthcare professionals or researchers affiliated with organizations that have experience treating patients with cancer and providing nutrition support for that population. Unaffiliated individuals are not qualified to apply for this grant. In addition to that, the patient population must be within MANNA's service area, and we provided a link for you to see that. You can see that also on our website. We have a wide distribution area in, I think, 7 counties in southeast Pennsylvania, as well as southern New Jersey. So we have a wide distribution area, but we do have to keep it to that area because if you read the RFP, we will be providing the meals for this project if you choose to have an intervention as your research. And so again, that has to be within our delivery area. We want proposals to be submitted by 5 p.m. on Wednesday, March 31st, 2021. The outline is pretty self-explanatory and typical. We'll look for a project summary, research goals and objectives, methodology, analysis plan, timeline, available resources you'll be using and partners, identifiable obstacles, your budget, and we'd like to see the CVs of principal investigator and research staff. We'll evaluate proposals based on your rationale for study of your proposed cancer population, your strategies, if you're going to do an intervention, if you have strategies for successful recruitment and retention. If you've done any research in this area before related to nutrition or to meal delivery, that would be helpful to see that in terms of any preliminary data. And also your research design methodology, as well as the feasibility of your project timeline. We'll look at the experience of your research team, your organizational capabilities, and your project budget. We are recording the questions, and the webinar will be available on our website. So if you know anybody who couldn't make it today, or you want to review that material, you can go to our website and see that. I will now open the floor for any questions and answer any and all questions that you have. So I'm going to ask my assistant, Adrian. I saw something pop up from Deborah DeMille on the screen. So I'm just trying to see, it's coming through the chat. Okay. Yeah. I can see the chat. Yeah. Okay. Would this exclude university-based researchers who aren't currently direct care providers? No, it does not exclude that. So I'm assuming that you would have a partner possibly have a partner with a healthcare facility, but the principal investigator does not have to be a direct care provider. I hope that answered that question. Is the $50,000 per pilot? Is it $50,000 per pilot or divided among the 3 approved pilots? It's $50,000 per pilot. So we will be offering up to 3 separate $50,000 grants. So that's a total of $150,000 that we're prepared to offer. Can you describe your standard of care services for your current patients with cancer, length of meals, and counseling interactions? Okay. So the MANNA, our services are standardized. We provide 21 meals per week, so we are considered a full meal services. We deliver those meals in frozen form once weekly. The average length of time that clients are on our services varies because we do address individual needs. It's generally a minimum, for our cancer patients, it's a minimum of 3 months and sometimes up to 6 months. We are a short-term service. We are not a forever service. Our role is to address nutritional risk while someone is experiencing a serious illness or exacerbation of a serious illness. So we do not have, so those are the qualifications for our program. About 40% of clients on our program are cancer patients. And one of the, I think, misconceptions about MANNA is that you do not have to be low income or food insecure to be served by our program. We serve everybody who qualifies based on serious illness and nutritional risk. Okay. Counseling interactions are offered to all of our clients. Nutrition counseling is offered to all of our clients. It's in the cancer realm. Some of our clients have dietitians at cancer centers, so they do not use our counseling services. And occasionally some do decline. So it is up to the client, and then the counseling is individualized to their need, similar to how a dietitian would operate in a clinic or in an outpatient area, or private practice for that matter. Okay, I hope that answered that question. Does the grant permit institutional overhead costs? Yes, it does. We did not specify the amount because we're not a typical funder, but yes, we will allow some overhead costs. So we would encourage you to write in either what your institution requires or what you think is an appropriate amount based on, I would say, an approximate example of a foundational funder. The length of the study can be anything, it's up to you. If you can do a study of any length, again, this is pilot work, but you define what you would like to know in the amount of time you would like to know it in. If it is an intervention study, we will provide meals for the length of that study. Okay. Okay, our stage 4 patients who have prognosis of approximately 2 years allowed. I would say that if that's who you serve in your clinic, or who you focus on from a medical standpoint, and you feel strongly that they would definitely benefit from our services, I would encourage you to write for a pilot. We're not discounting at all that group, and could conceivably be funded, but we'd have to see the full description of your project. Does the population have to be underserved or food insecure? No. As I said just a few minutes ago, MANNA's model is not focused on food insecurity or underserved populations. By nature, we do serve many people who are food insecure or who might experience low incomes because of where we are located and the zip codes that we serve in Philadelphia. But that is, neither of those are a requirement for our program. Would feasibility adherence endpoints be acceptable? Yes, absolutely. Those should be included in the project. Is there a definition for non-terminal cancer? No, we do not have a definition of that. So if you have something in mind, please describe it. Please describe anything that you have in mind in your narrative. Does the 50,000 grant need to be used for something specific, or is that set up to the discretion of the institution? So it's set up to the discretion of the institution or the researcher, but we are specifically looking to define outcomes that healthcare professionals who work in the area of cancer would consider important. So that's the core of the proposal request. Is there a minimum number of patients we need to refer during this study? No. What is your definition of terminal? I do not have one. So please describe your definition in the proposal. Does the cost of the meal program need to be included in the budget? No, we are providing all meals. If you choose an intervention study, we will provide all meals for that study. When describing researchers, do they have to be full-time staff, or can a research assistant be hired to conduct the surveys, questionnaires? A research assistant can certainly be hired to conduct any surveys or questionnaires. In your narrative, please describe who that would be, or who, in general terms, who you would look at, what qualifications they might have, and how they will be supervised. Will there be patient incentives beyond being a MANNA patient? You are welcome to build in any incentives that you consider important or that you feel are feasible within the terms of the grant. But no, we do not offer other incentives. So this is a project that you would define that may or may not include the incentives, depending again on whether you're doing an intervention study. How does MANNA's program reach out to, identify, and enroll patients? So again, the MANNA Institute is separate from our Division of Nutrition and Client Services. So I'm not sure I can fully answer that. There is another director who is over that area. So I will have her create an answer to that question that we will post in our frequently asked questions document that they will put on the website after this webinar. I don't want to misspeak in that area, and it's not my area. Many of you know Nicole Laverty. She is the head of that area, and I will have her answer that question. Do I understand correctly that study participants would not include current MANNA patients, but rather participants recruited by the research staff in the service area? Not necessarily. If you if you currently refer a lot of patients to us and you know us very well and you're in a healthcare system, you could potentially do a retrospective chart review if that was available to you. So it could potentially include MANNA clients who have already been served. Again, depending on how you want to structure and propose your study. Are there instructions for page limits? No, there are no page limits. Formatting guidelines? Nope. Is there an application portal for which this is submitted? No. We are not a foundation, so we don't have those things. So you may, if you wish, and this will go on our page as well, you may email me a PDF of the proposal or the RFP proposal, and I will respond that I got it. So I'll put that on the webpage just so that you know. You may also send that to Adrian Glass. Can you please provide the services that MANNA dietitians provide? Again, that's in our program area. So I will answer that. I will have Nicole Laverty write a response to that. I do not want to misspeak, as I do not supervise that area on a daily basis. She will know more about the services that MANNA dietitians provide to our cancer patients. If we are one institution with multiple locations, let's see. If we are one institution with multiple locations, could we conduct this study as one institution? So yes, absolutely, you could conduct a study as one institution with multiple locations. So how will the RFP recipient know or have access to patient data? Example, food intake, compliance with other requirement treatments or services. So that's the purpose of the RFP is for you to conduct that study. So you would decide, do you want to collect food intake data? How would you do that? Can you collect treatment compliance? How would you do that? Any other things that you define, you would tell us how you would collect them if in fact you're going to do a prospective study. So I hope that answers that question. Okay, I'm not seeing other things come up on the chat. So would you have, after everything that you've heard, do you have other questions at this point? So what I have to put together and post for everyone is more specifics about our client services. But does anybody have any more questions about our research area? Does MANNA have nutrient intake information for the meals that could be shared? Yes. Is this the first time you are funding these pilot projects? Yes. The pilot projects are made possible from a generous donation from the founding 8 of the MANNA Institute, and our founding 8 are listed on our website. Do all cancer patients receive shakes? Again, that's programming, client services, or other modifications if they don't want typical meals. Again, Client Services Department would answer that question most accurately. So I will also post an answer to that question from our Director of Nutrition and Client Services, Nicole Averty. Any other questions? Okay. Okay, would there be a different application form than the usual form? I'm not sure what's that? I see. Yes, it could be. And I see what you're saying. Okay, there could be, it depends on your project design. So please, describe your project in the way that you see fit, honestly. Certainly a clear explanation of a good project will be very understandable. So thank you. Anything else? It's coming on 11:30. And if there are no other questions coming, can we have a copy of the PowerPoint? Yes, it will be posted on our website. This whole presentation will be posted on our website. Any other questions? All right, it's 11:30. Thank you for your time, everybody. And we hope to see many good proposals. Thank you very much for your time today.